Hello everyone, I am Carl Jason B. Shera. So I will be continuing Chapter 3, Assessing Abnormality, Assessment Tools, and my focus for today's discussion is psychophysiological test, but I will highlight the topic that is assigned to me, which is the EEG. So before discussion, this will be the topic outline. First, we will define psychophysiological test and we'll try to give to you a gist how it works, its uses or its function, and the different types of it. Number two, we will introduce electroencephalogram or the highlight of my report, the EEG. Let's define what is it, how it works also, and its uses or function. And we'll try to give you cited pictures. We'll try to cite pictures for you to further uh, uh, understand or to know what is an EEG and also to answer questions later on. So this is the intended learning outcomes. At the end of the discussion, students were able to number one, know what is psychophysiological test, its function and its types, and identify electroencephalogram or the EEG and how it works and its uses. So now let's go to our discussion. First, psycho psychophysiological test. So what is the psychophysiological test? This is or it is used to detect changes in the brain and nervous system that reflect emotional and psychological changes. These are alternative methods to CT, PET, the SPECT, and the MRI. So this four, the CT, PET, the SPECT, and the MRI are discussed by the previous reporters. So psychophysiological tests or measures are used to assess people's emotional response to specific types of stimuli, such as response to war scenes in a veteran with post-traumatic stress disorder. So according to Kian and co-workers in 1998 showed that male military veterans with post-traumatic stress disorder or PTSD exhibited greater changes in psychophysiological responding. And for example, it's the increased heart rate, the skin conductance, systolic and diastolic blood pressure. One presented a series of trauma-related cues than did veterans without PTSD. So other studies also have found out increased physiological responsivity in females with PTSD and increased heart rate responses to startling tones in individuals with PTSD. So uh, this psychophysiological test could also function not only in post-traumatic stress disorders, but also with this following. First is an autonomic balance, for example, the heart rate or the diastolic blood pressure, as I've said in the cited example earlier, and salivation. Next is also for habituation to environment stimuli, reactivity to traumatic imagery, orientation response, and other physiological systems. So this psychophysiological test could also be used through the different types, like an electroencephalogram or the EEG, which will be the highlight of my report, the sweat gland activity known as electrodermal response, or formerly called galvanic skin response, which will be tackled by my co-reporter, Miss Cetera, and other types like the EMG or the electromyography, the fMRI or the functional magnetic resonance imaging, or the BOLD or the blood oxygen level dependent. Now let's move on to the highlight of this report, which is electroencephalogram or the EEG. So what is this EEG? It measures electrical activity along the scalp produced by the firing of specific neurons in the brain. EEG is used most often to detect seizure activity in the brain. For example, is for those clients who have epilepsy and can also be used to detect tumors and stroke. So, electroencephalogram or EEG, here there are EEG patterns that are referred to as evoked potentials or event-related potentials. So what is this evoked potentials or event-related potentials? So when EEG patterns over brief periods, such as a half second, are recorded in response to specific stimuli, such as an individual viewing an emotional picture, so that pattern are referred to as evoked potentials or event-related potentials. Clinicians can compare an individual response to standard response of healthy individuals. We do have also the types of EEG. So number one is a routine EEG. So routine EEG is a recording that lasts for about 20 to 40 minutes. During the test, a client can be asked to rest quietly. A client you will usually be asked to open or close his or her eyes from time to time. And in most cases, a client also will be asked to breathe in and out, and this will be a cold hyperventilation for a few minutes, and a flashing light may also be used to see if this affects the client's brain activity. Next is a sleep EEG or sleep deprived EEG. So what is this? A sleep EEG is carried out while the client is asleep. It may be used if a routine EEG does not give enough information or to test for sleep disorders. In some cases, the client may be asked to stay awake the night before the test to help ensure that he or she can sleep while it's carried out. This is why it is also called a sleep deprived EEG. Next is the ambulatory EEG. An ambulatory EEG is where brain activity is recorded throughout the day and night over a period of 1 or more days. The electrodes will be attached to a small portable EEG recorder that can be clipped onto your or into the client's clothing. The client can continue with most of his or her normal daily activities while the recording is being taken. Although he or she need to avoid getting the equipment wet rather. Next is the video telemetry. This is also called video EEG. This is a special type of EEG where a client is filmed while an EEG recording is taken. This can help provide more information about the client's brain activity. So the EEG signals are transmitted wirelessly to a computer. The video is also recorded by the computer and kept under regular surveillance by trained staff. And last is invasive EEG telemetry. This EEG naman is not common, but it may be used to check if surgery is possible for some people with more complex epilepsy or seizure. It involves surgery to place electrodes directly on the brain to find out exactly where the seizures are coming from. So, the first question we would like to answer is how EEG works, or how EEG is carried out. So to answer this question, the clinical neurophysiologist will explain the procedure to the client and will answer questions the client has to ask. This is, I think, the most simplest explanation I can give for you to identify or to know how EEG works or how EEG is carried out. So that is the number one. Number two, a consent to treatment will be asked for various parts of the test to be carried out. Number three, the scalp will be cleaned. The client's scalp will be cleaned. And number four, about 20 small sensors called electrodes will be attached using a special glue or paste, and these electrodes will be connected by wires to an EEG recording machine. So this is the literal picture of an EEG in real life. If you can see, this is the EEG cap. This is the electrodes that about 20. This is the amplifier that is connected to a machine or the wire. And this will be the result, the recorded video that will be processed, and soon the client will have the result. So next question is, what happens after an EEG? So when the test is finished, the electrodes will be removed and the scalp will be cleaned. Some clients will feel, or almost all clients who undergone EEG test will say na messy na yung buhok nila. So they can wash their hair if they need to. A client can go home after the test and if felt tired can have a sleep, especially for those client who undergone a sleep EEG or sleep deprived EEG. The recordings will need to be analyzed and I think it takes days and the client will be informed if the result is available and needed to discuss it with the doctor. And this is the last question and the last slide for my report. Are there any risk or side effects? So to answer that question, the EEG procedure is painless, comfortable, and generally very safe. Apart from having a messy hair after, normally there is no side effect. However, some may feel lightheaded and notice tingling in lips and fingers for minutes during hyperventilation part of the test. Some develop mild rash where electrodes were attached. If a client has epilepsy, there's a small risk it could have seizure. So that's it for my report. And Miss Itera will continue the report tackling about her part. So this is the reference of my report, our reference book. Thank you for listening.